Yeah, I'll be presenting on incidence of retinal vascular occlusion after COVID-19 infection. So, COVID-19 infection can be followed by multi-organ pathology, including vascular damage involving the venous and arterial systems. It predisposes the patient to thromboembolic events due to excessive inflammation, endothelial dysfunction, platelet activation, and stasis. The aim of this study was to explore whether there was a change in incidence of retinal vascular occlusions after COVID-19 infection. So, it was a retrospective study, and we saw incidence of new retinal vascular occlusions and compared them between the pre-COVID and the post-COVID era. So average incidence of retinal artery occlusion, as we see in this chart, that in pre-COVID-19 infection, the incidence rate ratio was 1, and post-COVID-19 infection was 1.3. And if you see between the immediate and the late post-op period, immediate as in till 12 weeks post-infection and till 6 months post-infection, until 8 weeks it was more as compared to the late infection. Similarly, for retinal vein occlusion, it was more in the immediate post-COVID-19 period than the late post-COVID-19 period. And also the associated systemic factors, they are diabetes, hypertension, and hyperlipidemia. They were associated with more in retinal vascular occlusion patients. So the results were there were 12 artery and 43 vein occlusions in the 6 months before the COVID-19 diagnosis, and 16 retinal artery and 65 vein occlusions in the 6 months after the COVID-19 diagnosis. So the highest incidence rate of artery occlusion was 10 to 12 weeks following the COVID-19 infection, and vein occlusion was 6 to 8 weeks following infection. And systemic vascular risk factors were more common in patients who had retinal vascular occlusion. So findings of this study suggest that there may be an increased risk of vein and artery occlusion after COVID-19 infection, and this increased risk is associated with secondary events such as worsening control of systemic blood pressure or lack of physical activity in the COVID area. And venous disease may predominate over arterial disease in patients with COVID-19 infection. Also, the evidence of increased risk for retinal vascular occlusion is associated with COVID-19 due to combination of vascular damage and risk of higher embolism formation. And the findings provide evidence of prothrombotic state induced by COVID-19 and indicate that the post-infection impacts last several weeks. So clinicians needs to consider this factor when evaluating these patients. Thank you.
How many of these patients did they undergo vaccination in between? You never looked into that.
We didn't compare that data.
Vaccination was one of the main reasons they have found associated with vasculitis or any vascular event happen in a patient.
I have one question. So this is a study done basically the people who came to the hospital. So that can be due to any means maybe a sudden by chance also. So if we want to do the incidence study, either we go in a proper community and ask them or check overall, or maybe we compare with the total number of patients came along with them. Means I don't think even sometimes you may see retina people see lots of people coming with a retinal detachment. So I cannot say that okay, these 2 months retinal detachment rate is higher. So if we want to see that incidence in a community, I think the study should be done community wise.
Also, one more marker was the difference statistically significant between the pre and post COVID six months?
Yeah, it was not for 6 months, but 10 to in the early post COVID-19, like 6 to 8 weeks, it was more common. And
no,
after,
disease wise, I mean.
Yeah.
Like artery occlusion per se, was the difference statistically significant? I think that was not studied.
No,
So that could be studied. Other thing is that, I mean, I do agree to sir that it cannot be a single clinic based, but obviously this has to be a clinic based study. But the only thing is that per se, if you see even a 12 cases data of 6 months for CRO is quite high. So that is quite high. And if you actually see post COVID, it's not like it's changed too much. So I think that is also one part I think which we need to, because RVOs, yes, you would see more commonly, but 12 CROs in 6 months is quite high. That's quite high data. Yeah. So I think then we really need to see whether we are frankly diagnosing CRO properly. I mean, all of us, frankly, if the incidence is so high, So thank you.
Okay, thank you.
Thank you.